ఏమవుతుంది? పొట్ట లోపలికి వెళ్తుందా బయటకు వస్తుందా? ఏమవుతుంది? వాట్ ఈస్ హ్యాపెనింగ్? ఇన్సైడ్. మీకేమవుతుందండి? చెయ్యి పెట్టి పొట్ట లోపలికి వెళ్తుందా బయటకు వస్తుందా గాలి పీల్చేటప్పుడు? ఇది పని చేయట్లేదు. ఏమండి ఏమవుతుంది? లోపలికి వెళ్తుంది, వదిలేటప్పుడు బయటకు వస్తుంది. మీకు పీల్చేటప్పుడు బయటకు వస్తుంది. కొంతమందికి బయటకు వస్తుంది, కొంతమందికి లోపలికి వెళ్తుంది. సమ్ పీపుల్ the tummy is going inside while inhaling, some people the tummy is coming outside while inhaling. Someone is doing right, someone is doing wrong, right? So these are the lungs here. When you inhale completely, they can become double their size till here. They can come till here. Okay? But this is not an empty space. There is stomach, there is this liver, pancreas, intestines, all are the place where lungs and heart are there. It is called, touch chestnava, chodu. See? అవుతుందా? ఓకే. This diaphragm. Okay? This is a partition. When the lung expands, it pushes the diaphragm, and for the lung to become double the size, it needs space. So where do we get the space when the stomach is entirely filled with organs? We have to create space. Entirely filled with organs. We have to create space. So we expand our tummy and expand our chest. When you expand your tummy, it is called diaphragmatic breathing. You push the diaphragm and create space by expanding the tummy. Diaphragm ni tosi abdomen ni peddadi chesi lungs ki space create chestam. It is called diaphragmatic breathing. When you push the diaphragm and create space for lungs. So while you are inhaling, the tummy should expand, not contract. బయటికి రావాలి, లోపలికి వెళ్ళకూడదు. ఓకేనా? బట్ ఇప్పుడు లోపలికి వెళ్తుందంటే అర్థం ఏంటి? గాలి పీల్చినప్పుడు ఇంకా ఇది లోపలికి వెళ్ళింది అనుకోండి, దీనికి స్పేస్ లేక ఇది పైకి వెళ్తుంది. లంగ్స్కి అసలు ఎక్స్పాండ్ అవ్వడానికి ఛాన్సే ఉండదు. When you are inhaling, if you are pushing your tummy inside, then you are not allowing the lungs to expand. Okay? So it is very important for us to expand lungs while inhaling. So when you are inhaling, expand the chest and push the diaphragm and expand the abdomen. Then you will get maximum air. So how do we practice this? Put your hand on your stomach, push while exhaling. నొక్కుతూ గాలిని బయటకు వదలండి. Push and exhale. Push and exhale. Then while inhaling, expand the tummy. Expand the chest and expand the tummy. While inhaling, expand. While exhaling, push. Okay? Sir, you please come. You said previously while you are inhaling, it is going inside, na? No, just lie down. Now take deep breaths. Take deep breath. Naturally you take deep breath. And slowly leave it. Again take deep breath. See what is happening while you are lying down, while taking inhaling, what is happening?
It's going down.
While inhaling, see, inhale, it is not going down.
It's going up.
So while you are in the lying down position, it is coming naturally, right? While you are inhaling, it is expanding naturally. You are not putting any effort. But while you are sitting, it is happening in a reverse way.
Okay.
Okay. Now we need this natural way of breathing while even you are sitting also. Okay. Yeah.
This can be observed easily in infants.
Infants, yes. Or anyone who is sleeping, you observe their breath. While inhaling, they will expand. That is the reason why in sleeping we get lots of relaxation. Because we are doing the breathing part right. While sleeping, while lying down. Sitting time also you have to do it in a right way. So push while exhaling, expand while inhaling. Do it meticulously. After some time it will come naturally. కొంచెం రోజులు ప్రాక్టీస్ చేస్తే న్యాచురల్గానే మీ లంగ్ కెపాసిటీ పెరుగుతుంది. పీలుస్తుంటేనే ఎక్స్పాండ్ అయిపోతుంటుంది. ఓకే. So why do we need more oxygen?
For oxygenating the blood.
So what will do? What will oxygen do?
It will purify all the impurities in the body from all It will carry it to cells.
What happens in the cells?
Purification of cells.
No, not purification exactly. Oxygen is the essential ingredient for production of energy. Food gets converted into energy. This energy production, oxygen is needed. Aerobic reaction, it is an aerobic reaction. If anaerobic reaction happens, food will not get completely converted into energy. Many byproducts will come, like lactic acid and other chemicals, which are harmful to the body. Without oxygen, energy production is harmful. With oxygen, energy production is pure energy production, no side byproducts. Okay? Our brain, which is a very small size part of the body, like this much size. Fist size brain is there. Okay? But it takes 20% of the oxygen I consume. Brain needs 20% of air. Remaining body 80%. Brain size is only 2-3% of entire body, but it takes 20%. Because lot of activity happens inside the brain. బోళ్ళంతా పని జరుగుతుంది బ్రెయిన్లో. అందువల్ల బ్రెయిన్కి ఎక్కువ ఆక్సిజన్ కావాలి. ఓకే. ఇఫ్ బ్రెయిన్ గెట్స్ లెస్ ఆక్సిజన్, then all the activities of brain will slow down and whole body becomes weak. It can happen. Similarly, heart. Heart is the one organ which is continuously working from birth till death. No rest. If it takes rest, we will rest in peace. Okay. So non-stop it is working, and that heart also needs lot of oxygen. The muscles inside the heart need lots of oxygen. If it doesn't get enough oxygen, heart function will become weak and entire body will be, circulation becomes weak and entire body will become weak. So heart needs lots of oxygen. Muscles, if you are sitting like this, so many muscles are working to make you sit like this. If those muscles are not working, you will fall down. There are so many patients who can't sit like this because their muscles are paralyzed. You are sitting like this, which means muscles are working. I am standing like this, more muscles are working. Okay? And to work, muscle need energy. Muscles, they take energy from the glucose break it down and convert it into energy. To convert into energy, they need oxygen. If there is no oxygen but still muscle is converting food into energy, then it is an anaerobic reaction in which lactic acid and other chemicals get produced as a byproduct which settle in the muscles. Muscles become rigid, bigsukupotayi muscles, tight ga. Then you become weak. So muscles also need oxygen. Similarly, the nervous system will get imbalanced if there is no proper oxygen to the brain. Airways, gali gottalu, airways through which air goes, they also need oxygen. If there is no proper oxygen to the airways, they become constricted. And further decrease in oxygen happens because airways are getting constricted. Similarly, blood vessels, if they are not getting proper oxygen, they constrict. Further the blood flow will decrease. It's a vicious circle. Less energy gets produced due to lack of oxygen. If there is oxygen, entire food will get converted into pure energy, no chemical byproducts. So to ensure perfect health, we need to understand the principles of intake of air. It's very important for us to take air in a right way. So these are the guidelines. Breathe only through the nose, not through the mouth. If you breathe through the nose we know that it filters the air. It also adds little humidity to the air. తేమను యాడ్ చేస్తుంది గాలికి. Otherwise dry air, it hits the lungs will get damaged. So converts dry air into humid air. Nose. Similarly, cold air, if it goes and touches the lungs will get damaged. So nose will add warmth to the air. Cold air ni hot air ga marustundi ముక్కులోంచి పీల్చినప్పుడు. లంగ్స్కి వెళ్ళేసరికి వెచ్చగా వెళ్తుంది గాలి. Okay. So it's very important for us to breathe through the nose, like that. Don't breathe through your mouth. Second important part is breathe through the diaphragm, diaphragmatic breathing. Push the diaphragm. Push the diaphragm, expand the stomach, expand your lungs and get maximum air. Diaphragm ne push chesi tu lungs ne baga expand chesi ekku gaali pీల్చుకో.
So we call it as a diaphragm breathing.
Diaphragmatic breathing or abdominal breathing.
So diaphragm telugulo emantaru?
Diaphragm telugulo ante తెలియదు. తెలియదు.
సంస్కృతంలో ఏదో పదం అన్నారు.
ఎవరు? గురూజీ అన్నారా? ఏం అడుగుదాం అయితే ఒకసారి మళ్ళీ. Breathe in a relaxed way. So when you are breathing, so many respiratory muscles are working. If these muscles are rigid and tight, you will not be able to breathe in a relaxed way. So keep all these muscles relaxed, then breathe. If they are tight, they will not allow the lungs to expand. Keep them relaxed. Consciously keep them relaxed. Afterwards, naturally they will relax. Okay? So all these respiratory muscles, even the neck muscles, shoulder muscles, all these muscles are relaxed, then your breathing is good. If they are all tight, then your breathing is bad. Okay? Then breathe rhythmically. There is a rhythm for everything in this world. There is a rhythm in which the earth rotates on its own. Earth rotates around sun. There is a rhythm for everything happening inside the universe. Sea waves, tides, everything. In the body also there is a rhythm. There is a rhythm in our brain waves which we measure with EEG, electroencephalogram. There is a rhythm in our heartbeat which we measure using electrocardiography, ECG. If there is some disturbance in the rhythm, arrhythmia, cardiac arrhythmia, which is a disease. Similarly, there should be a rhythm for our lungs breathing also. Always breathe in a steady pace, not too fast, not too slow, rhythmatic breathing. And breathe silently. While you are breathing, if you can feel the breathing, sounds are you can listen to them, then there is a problem. So while you are breathing, the breath should be silent. Particularly while sleeping, if snoring is happening, which means the airways are constricted. So then there is a problem. We have to correct it. Initially, we can use some Anutailam, Shadbindu Tailam to open the airways. But that is not a permanent solution. Permanent solution is regular practice of pranayama, kapalbhati and bastrika. That will open up all the airways.
So why a healthy person suddenly needs a ventilator?
Suddenly he will not need.
No, definitely they need a cylindric oxygen at that time. Normally they breathe. When they join in the hospital, they will keep this compulsory it is, otherwise you can't catch the air. They say. So why it happens?
Thing is, they will not keep oxygen for everyone. But those people who are gasping for air, while at home they don't know that they are gasping for air. First, the moment you go to the doctor, they will check the oxygen concentration. If the oxygen concentration in the blood is less, then they will put some oxygen mask. But if that is not sufficient, if the lungs are not naturally taking the oxygen, then they will push using a ventilator. But once a person goes on to a ventilator, he should be very strong to come back. Mrityunjay. Only some people can come out of it. Because the atmosphere is not helpful. Completely closed, no sunlight, no fresh air, only AC. So chilling atmosphere where the digestive fire becomes slow and slow and slow. So unless you are super strong, you will not be able to come out of it.
What is the reason why that?
Various reasons are there which cause the person not to breathe naturally. Sometimes heart problem, sometimes problem in the brain, some disease, some infection, some lungs problem, some accumulation of fluid inside the lungs, so many reasons.
Normally we see this is mainly in old people when they become very old.
Yes.
They will get the problem of breathing air very slow and
Yes.
difficult to breathe.
Yes.
Because of the age also.
Because of the age, it is less. Because of the age, some diseases might happen. Some accumulation of fluid inside the lungs will reduce the breathing. Then we have to push. Okay.
It is also a byproduct.
Yes, of age. So, I will give you some simple tips for observing your breath properly. Create a breath check trigger. For example, there are some activities which you will do definitely, like brushing your teeth or doing puja, eating food, working on a computer or cooking. Some activities you will do regularly now. Attach breath check to these activities. Just before brushing my teeth, I will observe my breath. If I am not taking the breath properly, I will start taking deep breaths. Just before eating food, I will observe my breath. Just before going to my office, I will observe my breath. Just before sitting before my desk, I will observe my breath. Like that, you attach this activity to other activity which you will definitely do. Or you might take a small visiting card size stickers, right? Observe your breath, swasani gamaninchu, on the sticker and paste it on different places, on your door, on your switchboard, on your computer desk, on your car dashboard, on your fridge door, washing machine door. Whenever you see the sticker, stop everything, observe your breath. Okay? So, respiratory rate, which means number of times we inhale and exhale in 1 minute, is respiratory rate. For human beings, it is 14 to 18 times per minute. Okay? 14 to 18 times per minute for human beings. In 1 minute, 14 to 18 times we respire. For dogs, it is 25 to 28 times. Dogs. For tortoise or turtle, it is 5 to 8 times. 5 to 8 times in tortoise. So what is the difference? Human beings live for 100 to 120 years. Dogs live till 20 years. And tortoise, they can live for 200 to 300 years. Which means the respiratory rate defines the length of our life. Of course, the quality also. The less the respiratory rate, the more your long life, longevity. That is the reason why when you practice pranayama, you are bringing down your respiratory rate drastically. There are some rishis, there are some yogis who do samadhi. They almost take their respiratory rate to 0. They live for long duration. Then oxygen supply will be less. Oxygen supply will be less. So this is an important topic, important point of discussion.
Metabolism is less.
Normally, why do we need oxygen?
For metabolism.
Energy production, cell building and cell death. Anabolism and catabolism. Anabolism is construction. Catabolism is destruction. For both construction and destruction, you need oxygen. Okay? But here the yogis, they are minimizing this metabolism. They are not allowing construction, they are not allowing destruction. Nothing is happening inside their body. They are just sitting still. No activity. Zero activity or very less activity. So you need very less oxygen. They even slow down the heartbeat. There are some yogis who have successfully stopped their heart at will. Even Paramahamsa Yogananda, they did a lot of researches on him. He could stop his heart at will. Heart is not a voluntary muscle. ఇప్పుడు మనం చెయ్యింది అనుకోండి, మనం కదపాలనుకుంటే కదుపుతాం, వద్దంటే మానేయగలుగుతాం. హార్ట్ అలా కాదు, మన కంట్రోల్లో ఉండదు, ఇన్వాలంటరీగా జరుగుతుంది. అలాంటి ఇన్వాలంటరీ మూమెంట్స్ని వాలంటరీగా కంట్రోల్ చేసే శక్తి వస్తుంది యోగులకి. ఓకే, ఎస్ 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 ఇన్ స్లీప్. Okay, so when you do a lot of sadhana, when you go beyond yama, niyama, asana, pranayama, okay, pratyahara, then this dharana, dhyana, samadhi, there the respiratory rate becomes slow and slow and slow and slow. Okay, so ఇప్పుడు దాకా చెప్పుకున్న దానికి ఆపోజిట్ ఇది. ఇప్పుడు దాకా ఏం చెప్పాం? ఎక్కువ ఆక్సిజన్ తీసుకోండి అని చెప్పాం. సాధనలో ఏమవుతుందంటే తక్కువ ఆక్సిజన్ అవసరం అవుతుంది. ఓకే, ఈ రెండు డిఫరెంట్ థింగ్స్. Yes. Exactly. So please understand that initially you have to increase your lung capacity, and also if you increase your lung capacity, you will reduce the number of breaths, na? షాలో బ్రీతింగ్లో చూడండి, మనం స్ట్రెస్లో ఉంటాం, టెన్షన్లో ఉంటాం, అలా బ్రీతింగ్ చేస్తాం. దెన్ ద నెంబర్ ఆఫ్ బ్రెత్స్ ఆర్ ఇంక్రీజింగ్ అండ్ లెస్ నెంబర్ ఆఫ్ ఆక్సిజన్. When you are relaxed, when you are happy, when you are meditating, when you are in a very pleasant state, observe your breath. It is so slow. So whenever you are disturbed, you observe your breath. It will be shallow. Now you want to come out of this disturbed state. ఆ disturbed state నుంచి బయటికి రావాలనుకుంటే ఏం చేయాలి? Change your breath. Change it from shallow breath to deep breath. అయితే ఏమవుతుందంటే అండి, many of my patients, when they are in severe pain, their breath will be very shallow. చాలా సివియర్ పెయిన్ వస్తుంది. ఆ పెయిన్లో ఏమవుతుందంటే అలా గాలి పీలుస్తుంటారు. వాళ్ళకి ఏం చెప్తాము? డీప్ బ్రీతింగ్ తీసుకోండి అని చెప్తాం టు రెడ్యూస్ ద పెయిన్. బట్ దే విల్ సే ఐ కాంట్, నేను తీసుకోవాలనుకుంటున్నాను, తీసుకోలేకపోతున్నాను, అవ్వట్లేదు, నాకు అవ్వట్లేదు. దే ట్రై బట్ దే కాంట్ డూ డీప్ బ్రీతింగ్. Sometimes even for us also it happens. We are in a tense state, we want to take deep breaths, but deep breath will not come. Then what will we do? Then we tell our patients, okay, don't take deep breath, stop breathing, hold your breath. Hold your breath for as much as you can. శ్వాసను బాగా బంధించమని చెప్తాం, ఎక్కువసేపు బంధించమని చెప్తాం. Until it is impossible to hold, you hold. Then you start breathing. Then deep breathing starts. అంతసేపు కుంభకం చేసిన తర్వాత అప్పుడు దీర్ఘమైన శ్వాస వస్తుంది. ఆపకుండా శ్వాసని సడన్గా డీప్ బ్రీతింగ్ చేయమంటే రాదు. సో వెనెవర్ యూ ఫీల్ దట్ యువర్ బ్రీత్ ఇస్ షాలో, వాట్ యూ హ్యావ్ టు డూ? హోల్డ్ యువర్ బ్రెత్ అండ్ దెన్ స్టార్ట్ డీప్ బ్రీతింగ్. Just before having food, if your mind is disturbed, what should we do? Hold your breath for some time, then start deep breathing. Then mind automatically goes from a bad mental state to a better mental state. Problems will not get solved, but mind becomes relaxed.
Gets awareness.
Awareness వచ్చేస్తుంది. Correct. Problem will not increase also. Problem will not increase. ప్రాబ్లమ్ని సాల్వ్ చేయగలిగే శక్తి వస్తుంది. లేకపోతే టెన్స్లో ఉన్నప్పుడు మనకు సొల్యూషనే దొరకదు, ఆలోచించే శక్తి పోతుంది. ఓకే. అండ్ వాట్ ఎవర్ యాక్టివిటీ యూ డూ, యూ ఆల్వేస్ రిమెంబర్ రిథమాటిక్ బ్రీతింగ్. ఫర్ ఎగ్జాంపుల్, యు ఆర్ క్లైంబింగ్ స్టైర్స్, మెట్లు ఎక్కుతున్నారు. 2 stairs you breathe in, 2 stairs you breathe out. 2 మెట్లు గాలి పీలుస్తూ ఎక్కండి, 2 మెట్లు గాలి వదులుతూ ఎక్కండి. అలా ఎక్కుతూ ఉండండి. 10 stories ఎక్కినా కూడా, 10 ఫ్లోర్లు ఎక్కినా కూడా మీకు ఆయాసం రాదు. 2 కాకపోతే 3 మీ ఓపిక. శ్వాస పీలుస్తూ 2-3 మెట్లు, శ్వాస వదులుతూ 2-3 మెట్లు, రిథమాటిక్గా. అలా మీరు 10 ఫ్లోర్లు ఎక్కినా మీకు ఆయాసం రాదు. జనరల్గా మనం ఏం చేస్తామంటే గాలి మెట్లు ఎక్కినప్పుడు గాలి బంధించి ఎక్కేస్తాం టకటక. ఒక ఫ్లోర్ ఎక్కగానే ఆయాసం వస్తుంది. కాన్షియస్ బ్రీతింగ్ ఈజ్ ద సొల్యూషన్ టు సో మెనీ ప్రాబ్లమ్స్. కాన్షియస్ బ్రీతింగ్, అవేర్నెస్తో బ్రీతింగ్, ఎరుకలో ఉండి గాలి పీల్చడం, దట్ ఈస్ ద ఓన్లీ సొల్యూషన్. జస్ట్ బై ఆల్టరింగ్ యువర్ బ్రెత్ ప్యాటర్న్ యూ కెన్ ఆల్టర్ యువర్ లైఫ్. జస్ట్ శ్వాసను మార్చడం ద్వారా జీవితాన్ని మార్చేయచ్చు. Okay, so always keep yourself aware of your breathing. దానికి ఇనీషియల్గా చిన్న స్టిక్కర్లు అంటించుకుంటారా, లేకపోతే మీరు చేసే యాక్టివిటీస్కి బ్రీతింగ్ లింక్ చేస్తారా, యువర్ విష్. కాన్షియస్ బ్రీతింగ్ నిమిషం మీకు ఎప్పుడు గుర్తొస్తే అప్పుడు బ్రెత్ని కరెక్ట్ చేసుకోవాలి, చేంజ్ చేసుకోవాలి. ముక్కు ద్వారా గాలి పీల్చుకోవడం, ముక్కు ద్వారా. అండ్ ఆల్వేస్ వన్ నాస్ట్రిల్ విల్ బి టైట్, one nostril flow will be free, another nostril it will be tight.
Today blocked, right? Not open.
Yeah, it happens, and it is not same always. Sometimes right will be blocked, sometimes left will be blocked. Okay, don't worry about it.
That may be the body property also.
It is natural. ఒక్కొక్కసారి సూర్యనాడితో గాలి పీలుస్తాం, ఒకసారి చంద్రనాడితో గాలి పీలుస్తాం.
That is there, but blockage is for some people property.
For some people, for most of the people, there will be a deviated nasal septum. 85% of human beings have deviated nasal septum. Nasal septum అంటే మధ్యలో ముక్కు దూలం, అది ఒక సైడ్కి ఉంటుంది, అందరికీ ఉంటుంది. ఏదో ఒక సైడ్కి ఉంటుంది, ఒక సైడ్ ఫ్రీగా ఉంటుంది, ఒక సైడ్ ఖాళీ. So if you have some sinusitis, some ENT problem, you will go to the ENT doctor. Doctor say, "Arey, you have deviated nasal septum. Go for surgery."
That was told to Meghana also.
Huh. Actually, it is common. Exactly, if you have nasal septum in between without any deviation, then you are abnormal.
He said all that. When I went to Manasarovar permission,
Uh,
he said, you can't go there.
you have a deviated nasal septum.
You have to do surgery. Let it be. Another 20 days you will go. But don't go there.
So, deviated nasal septum is not an abnormality. You don't have to go for surgery if you have a deviated nasal septum. Practice pranayama, all problems will get solved. Okay.
The common problem, I say, for all of them, all of us, when we are in childhood, when we travel in bus or train, we would like to sit nearby the
Window.
side. The next day, without knowing, we will get blockage.
Yes.
We suffer a lot.
Yes.
So, is it the environmental problem or
Yes.
our own problem?
No, not our own problem. The cold breeze will definitely create production of excess mucus. Okay, that blocks one or two nostrils. Some people are too strong, they will not have some problem, that problem, but most of the people will get it.
We use mask for that.
Yeah, mask can be used.
We can enjoy and
Yes, yes, yes.
protect ourselves.
Yes. So, if there is one thing you learn from here and go back and implement, that should be conscious breathing. Even if you don't do anything else you learn here, do this one thing. శ్వాసని గమనిస్తూ దీర్ఘమైన శ్వాసను తీసుకోవడం. This is one thing I want you to go back and implement in your life. Every day, conscious breathing. It's so effective, so helpful. It itself will solve majority of your health problems, and it will make you focused. Your work will increase, output will increase, your brain will work better, your concentration and creativity will increase, your memory power will increase just by practicing conscious breathing. Okay?
That, if that comes, 90% yogi he becomes.
Yes, yes.
Sir, in house, okay, ensure like more percentage of oxygen is there in the intake.
Open all the windows. See, particularly during sleep, if you close the windows and sleep, then you are not allowing fresh air to reach you. And if fresh air doesn't reach you, then it is a big problem. Brain needs lot of oxygen, particularly during sleep. Okay? Many people say, sir, we have AC. If we open the windows, all the AC will go out. Our current bill will increase. Better to have a higher current bill than a higher hospital bill. Right? So even if you have AC, open the windows. Let the air come in. Okay, or you keep a cooler outside the window. Cooler will send fresh air inside forcefully.
No, here again, maybe pollutants are contaminated. How do you ensure like make more oxygen?
See, if you know that your area, for example, you are living in Delhi and obviously the air is polluted, then you have to install some air purifier and all, and your life's aim should be to move out of that place, get a better job or even normal job in some other city where there is more pure air, or move to a village, get some work from home thing or something like that. In offices also they seal the entire building, centralized AC. One of my friends, he was a vice president in Satyam Computers long back, very long back. He told me that management has observed that because of the central AC, their current bill is too high. And the current bill is too high because this for circulating the air, because when you bring the outside air inside, that air is hot. To make that hot air cold, again you need more AC. So, to minimize the electricity bill, they reduced the circulation of air. So, the outside air is not coming inside. In the car also there is a switch, when you put it on, you will not get outside air inside, only the inside air will circulate. Then you feel chilling, but you are not getting fresh air. Similarly, they did the same thing to their employees. The current bills reduced drastically. But imagine all those computer engineers are there working with their brains, and their brain needs lots and lots of oxygen. Now you are making your own employees weak mentally by reducing the oxygen flow. Then output will reduce. Maybe your current bill will reduce by few lakhs, but your output will reduce and you will get more losses.
99% of companies will do the same.
They don't
Corporate
know
sector.
they are not thinking of it.
Yes. So it's very important for us to
Enclosure only.
every half an hour go out to the balcony or somewhere where you get fresh air, take some fresh air and come back and do work. If you are
Going, that's all. They flow they are going. They are not thinking what is basically.
so it's very important for us to create awareness about breathing.
If instead of AC, air cooler is better.
Cooler is always better. See that cooler there, it is outside the window. Okay? So it will forcefully send the fresh air from outside to inside. That is better.
But AC air is inside only.
Inside only it will circulate. Even if some air comes from outside, it is very little. Okay? So I want you to think more about.
What is the main reason for the valves problem in the heart? Because nowadays making cash by normal people also keeping that all the what we say
Stents.
stents unnecessarily.
See, what is the reason for stenting is the atherosclerosis. The vessels get coated.
Because of cholesterol only.
Yeah, cholesterol is one reason. There are so many other reasons which will coat the vessels, and the vessel's lumen will become narrow, 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 and flow of blood will become very difficult. Of course, with simple medicines and health practices, you can remove those blocks. 80% block, 90% block in vessels, you can reverse them. I am treating so many patients who don't want to go for stenting or bypass surgery. They use medicines and start practicing more and more pranayama, and now they are happy without stenting.
That is main problem. The taking of the edible oils we use, that how and what way they prepare we don't know. That will cause a main blockage.
That is the reason why the heart surgeon told us, the research says that the vegetable oils are the main reason for atherosclerosis. Okay. So if you get cold pressed oil, then you are not having any risk of heart problem, no risk. Okay, so it is better to invest in.
Cold press oil also we should not heat it to some extent.
Yeah, smoke point. When you are cooking, if it reaches the smoke point where smoke starts coming from the oil, that is dangerous, too dangerous. It will cause very serious diseases. So the oil should not cross the smoke point while cooking. It is very important.
Nowadays they are doing that puri whenever they prepare, definitely first they heat it, after smoke coming only, that is signal for them, they will
Wrong, it is wrong. And in the intake, the last part is intake of sunlight. Generally people think that sunlight will give vitamin D3, only vitamin D. No, sunlight is very essential for so many other things. Like if you expose your body to sunlight, it will protect you against inflammation. శరీరంలో పూత పూసినట్టుగా అవుతుంది కదా రకరకాల చోట్ల, ఆ వాపు నొప్పి inflammation will reduce if you expose your body to sunlight. It boosts your immunity. Sunlight will boost your immunity. Sunlight will reduce the high blood pressure. Just exposing your body to sunlight reduce high blood pressure. It strengthens your muscles. It improves your brain function. It improves your mood and reduces depression. If you are in a depressed state, go out and sit in the sunlight. Take one glass of hot water, drink hot water, sit in the sunlight. Your mood will get elevated. Anytime. Anytime means not harsh sunlight. Harsh sunlight is again bad because of UV rays and all rays will damage the body. Yeah, 6 to 8 in the morning, evening some 4 to 6, that time is okay. Then it improves sleep, strengthens our bones we understand because vitamin D. Heals skin diseases, promotes eye health and even protects against cancer. So you have to prepare some rituals in which automatically you spend time in sunlight. Play with your kids on the terrace or in the ground where sunlight will come, or do some gardening, or do some cycling, or do something which will help you expose your body to sunlight. While you are doing that, wear only cotton clothes. Cotton clothes will allow the sunlight to pass through the clothes and reach our skin. పల్చటి కాటన్ నైటీ అలాంటిది ఏదైనా వేసుకుని అప్పుడు సన్లైట్కి బాడీని ఎక్స్పోజ్ చేసుకుంటాం. Yes. Any activity. ఒడియాలు yes, anything which will help you get that wonderful essential ingredient called sunlight. Okay. So we have completed intake. Now we will go to the routine part. So sometimes we feel that whatever activity we do, it happens so naturally without any effort. And some days even the small task becomes so difficult with so many obstacles. Have you experienced such thing? ఒక్కొక్కసారి ఏ పని మొదలెట్టినా చాలా ఈజీగా అయిపోతుంది, ఒక్కొక్కసారి చిన్న పని కూడా చాలా కష్టంగా ఒక పట్టాన తేలదు పని. అలా ఎప్పుడన్నా అనిపించిందా? Many instances like that, right? Why is that happening? So if your routine, your daily routine is in sync with the universal routine, your circadian rhythm is in sync with the universe, then everything is a cakewalk, free flow. If your routine is against the universal routine, your circadian rhythm is not in sync with universe, then it is like upstream swimming. ఏటికి ఎదురెదడం అంటారు కదా, ఎదురు నుంచి ఇలా నదొస్తుంటే ఇలా ఎదురెదడం ఎంత కష్టంగా ఉంటుంది, అంత కష్టంగా ఉంటుంది ఏ పని చేసినా కూడా. ఇట్ ఈస్ సో డిఫికల్ట్. ఓకే, సో ఇట్ ఈస్ వెరీ ఇంపార్టెంట్ ఫర్ అస్ టు హ్యావ్ ఏ nice harmony between our routine and universe. So first we need to understand circadian rhythm. What is circadian rhythm? See, there is a biological clock inside the body. Okay, according to this clock every activity happens inside the body. This clock will decide what to do at what time, and this clock is getting influenced by various environmental factors. This clock is not having any battery. ఇదివరకు బ్యాటరీ లేని క్లాక్స్ ఉండేవా? కీ ఇచ్చేవారు, కీ ఇస్తే మళ్ళీ తిరిగేది, మళ్ళీ ఒక రోజు అయిపోయిన తర్వాత మళ్ళీ కీ ఇచ్చుకోవాలి, అవునా? దిస్ క్లాక్ ఈజ్ ఆల్సో లైక్ దట్. విచ్ క్లాక్? నో, నెసెసరీ. This biological clock needs keys. They are called cues or Zeitgebers. Every day they reset. For resetting your clock you need cues, and these cues are called Zeitgebers. Zeitgebers lo okati light. For example, morning you open your eyes, light falls on your eyes. These photons will reach the eye, and from there they get converted into electromagnetic signals and they reach the brain. In the brain there is a part called suprachiasmatic nucleus. That is the body's clock. Then it understands, oh, manod lechadu, this guy has woke up. If he is now getting up, after half an hour he will start yoga. It is having a timetable. Then after 1 hour he will have some ragi java or breakfast. Then after 2 hours he will do work before the computer. Then after that 3 hours he will have lunch. Everything it plans accordingly. Okay, so to reset this clock, first cue is early morning light. There are other cues like eating. If you eat now, night dinner you are eating at 7:30. So body thinks, oh, if he is eating at 7:30, after 2 hours he will sleep. 9:30 or 10 o'clock he will sleep. If he sleeps at 10 o'clock, he will get up at 5 o'clock in the morning. Like that it will set the clock. Okay, but if you eat late, 10:30 you eat, then it will think if he is eating, maybe after 2.5 hours he will sleep. But immediately you will sleep. Body gets confused.
Irregularity when it comes disturbs.
Yes.
Because that irregularity only making our
Diseases.
Timings, items also. Not only timings, eating items also.
Items also. Like every day you are eating fruit for dinner. If you eat fruit in the afternoon, it will get confused.
Only asks it.
And then sleeping also. If you are sleeping now, it will accordingly plan the next timetable. Social interaction, temperature, according to the temperature outside, according to the temperature inside the room also it will plan. Oh, now it is hot, maybe it is mid-noon now. Accordingly it will plan. Seasons and the physical activity you are doing, yoga he is doing, oh now he is doing yoga, so he will eat more, I have to plan accordingly. Like that it will plan. So all these are called Zeitgebers or cues, key ఇవ్వడం అన్నమాట క్లాక్కి. And there are some artificial Zeitgebers, like artificial light. Night time, 10 o'clock, 11 o'clock, light is there. Body thinks it is still daytime. So the clock gets disturbed. Till 12 o'clock you are sitting in the light and working. So body thinks it is still daytime. So continuously you are disturbing your body like this, disturbing the circadian rhythm like this, then the entire circadian rhythm gets disturbed. So when the cues observed in the nature sync our behavior with our rhythm with Earth's rotation, they maximize our health, mental illness, immunity, awareness and physical strength. Whenever there is an out of sync, your body is not in sync with the universe. Yesterday we have seen Vata, Pitta, Kapha times. When the Pitta is heavy, active, then if you eat food, then it will be easily digestible. But after the Pitta time, if you eat, it will not get digested properly. So you have to sync. See, the sunrise, sunset, moonrise, everything has an effect on your body. Accordingly, we have to set our routine. If you don't, then you will get circadian rhythm disorders, mood disorders, depression, bipolar disorders, a very big, huge psychological disease, heart disease, obesity, Alzheimer's, epilepsy, Parkinson's disease, cancer and so many other disorders are affecting human body due to bad circadian rhythm. Just మన రొటీన్ సరిగ్గా లేకపోవడం వల్ల ఈ జబ్బులన్నీ వస్తున్నాయి. పార్కిన్సన్స్ డిసీజ్లో బ్రెయిన్ సెల్స్ డెత్ అవుతాయి అన్నమాట. అప్పుడు ఇట్లా 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 కంపవాతం అంటారు. రిజిడ్గా అయిపోవడం వల్ల కూడా అవుతుంది అన్నమాట పార్కిన్సన్స్. ఎస్, like this. Okay. So all these diseases are not due to some infections or not hereditary. They are affecting human body because of bad routine, which is not in sync with the universe. Simple. And solution is good routine in sync with the universe. That's all.
Whoever they have discipline, okay.
Yes.
That misses everything.
Yes. So see, the body's master clock is called suprachiasmatic nucleus, SCN. Okay? It is there in the hypothalamus of the brain. When the light enters the human body, the photons get converted into, in the neurons they get converted into electromagnetic signals and they enter the suprachiasmatic nucleus. And when the suprachiasmatic nucleus gets the first information about the light entering the eye, it starts giving information to entire body, each and every organ. You start working, this guy is awake. Start working like that. And then each and every part will become active. Each and every cell will become active. Okay? So yesterday I have shown you this. When the Pitta is active, 6 to 10 Kapha is active, 10 to 2 Pitta is active, 2 to 6 Vata is active, 6 to 10 again Kapha, 10 to 2 Pitta, 2 to 6 Vata. So according to this, if you plan the routine, then your routine will be smooth sailing, no hiccups. But if you are forced to do reverse routine, like if your job is demanding, you have to work in the night time, sleep in the daytime, and that too 1 week it is like this, 1 week it is like that. 1 week night duty, 1 week afternoon duty, 1 week morning duty, they are doomed. We can't do anything. At least if it is one single routine fixed for every day, can be managed. But every 10 days, every 15 days, if you are changing your routine, it is so difficult for the body to get adjusted. So difficult. Okay?
Is it the Pitta percentage of the people are more in the world?
No, not like that.
Can't we differentiate like that?
No, we can't. Combination is also there. Nowadays, there is a abhiyan in India to know the people's prakriti. So all the government doctors, they were given task to go to each home and use the app and
Survey is
happening. Vata Pitta Kapha, there is an app.
Normally Pitta they say, Pitta people are more and That is the reason the Srishti is running this.
I don't know about that.
Sleep paralysis is related to this one.
Huh. We call it sleep apnea. Okay. So, where you don't get enough oxygen during the sleep. Okay. So, that is also related to disturbed lifestyle. Okay, but I want you to understand about melatonin. It is a very important topic. Melatonin is a hormone which gets produced by pituitary gland. Pituitary gland is like third eye of human body. Okay?
Master gland.
So, this melatonin is called sleep hormone. When enough melatonin gets produced inside the body, you will get sleep. But melatonin is not just responsible for your sleep. It is responsible for so many important activities during the sleep, like regeneration of the cells, repair of old cells, production of energy, building of tissues. So many things happen during the night time when you are asleep.
Sexual gland opening power something.
Yes. Kundalini awakening. So, this melatonin, if it is getting produced properly, your sleep and the activities during the sleep will happen normally. But if the melatonin is not getting produced properly due to exposure to artificial light, during the exposure to artificial light, 50% production of melatonin decreases. Normally, after sunset, the melatonin production starts. It peaks between 8 to 12, like that time. So, by 9:30 you feel drowsy, only if you switch off your light. If you switch on your light, melatonin production will be reduced, and then after Pitta Kala you become active, you don't sleep. Okay, melatonin production and related activities which will regenerate your body, recharge your body, prepare you for the next day, to give maximum energy to spend in the whole day. You need proper sleep, proper production of melatonin.
Even that is also in limits only.
Evi.
If body requires, it won't listen to the person. If he is
It will not.
to work, it will need, compulsory it will take rest.
Yes.
Forcefully.
The thing is, if you are sitting in a class, you want to listen, but your body is forcing you to sleep, you will sleep. But if you are using your phone, okay, which is more interesting, where there is involvement of you and interesting things. Class will not be that interesting, but things happening on the phone will be more interesting. Then it will dominate and it will make you awake.
Unlimited time.
Yes, without knowing. So doctors are prescribing melatonin capsules, melatonin syrups to give you better sleep, better metabolism. And you have to purchase it. It is costly. But free of cost you can produce melatonin if you just switch off your light. Switch off your light, you produce melatonin. Simple.
But I think it is not advisable.
It is not advisable. Artificially taking anything, any substitute is not bad, not good. So, traditional health practices of sleep hygiene, meditation, exercise, daily cleansing, all will make our routine better. Energy levels throughout the day they will maintain properly. Otherwise, by afternoon battery is dead. Cell phone's battery is still there, but our battery becomes dead. We will not be able to perform properly if you don't recharge during the night time. With regular practice, more mental alertness, your daily schedule, if it matches the rhythm of Earth cycle, it leads to greater productivity and improved motivation, health, happiness, prosperity, everything. So, the first cue is waking up early. In the routine, first cue is waking up early. Early morning time is the best time to do some really useful activities like meditation, pranayama, going into, like today morning we have practiced silence, non-judgment, Shunya Sthiti practice, so many other things you can practice. Higher mental practices, early morning time. Creative activities, early morning time. Studies, early morning time. Any activity involving your brain, early morning time. You want to allow the cosmic energy to flow into your body, early morning time. Okay?
Nowadays, people are students studying up to
So, waking up-
midnight 11, 12, 1.
Waking up early is dependent on going to bed is.
Early, yes. It's true. Students say that I am a night owl. My body nature is like this.
No, they have a lot of idioms.
Huh. But research proves otherwise. Research conducted in European countries, Western countries, they say that rising before sunrise makes the person active for whole day, as it synchronizes our circadian rhythm, which has influence on the performance of an individual across the day. Study shows that early rising children are more active than late risers. This research happened not in India, it happened in US in 1991. Early morning risers are more active physically, mentally than late risers, in children also.
డ్రావింగ్ శర్మ కూడా ఆ బుక్లో ఇచ్చారండి.
Ah.
మీరు ఇచ్చే గిఫ్ట్, పిల్లలకి ఇచ్చే గిఫ్ట్ మార్నింగ్ లేపడం.
అవును అవును వాళ్ళకి అలవాటు చేయడం అనేది చాలా ఇంపార్టెంట్. ఓకే, సో ఇట్స్ వెరీ ఇంపార్టెంట్ ఫర్ అస్ టు వేకప్ ఎర్లీ ఇన్ ద మార్నింగ్ because it is backed by research. All over the world, researchers have proved that early morning risers are active throughout the day, they are healthy. So what is Brahmi Muhurta? Brahmi Muhurta is an Indian tradition. We have to get up in Brahmi Muhurta. There are 30 Muhurtas in one day. Normally we have 24 hours in one day, but our ancestors have divided one day into 30 Muhurtas. One day means today's sunrise containing 30 Muhurtas. One Muhurta is 48 minutes. Okay? So the 29th Muhurta is Brahmi Muhurta. For example, if today sunrise, 29th Muhurta is 4:24 to 5:12. That 4:24 to 5:12 is Brahmi Muhurta. It can change according to the sunrise time. You can calculate accordingly. But around 4:30. Okay? Brahmi Muhurta is a sacred time when all the aspects of body, mind and senses